You may have something called obstructive sleep apnea. Obstructive sleep apnea is not just about snoring. It's a serious disorder that carries lots of implications. It places a patient at risk for stroke, heart disease, and even difficult to control diabetes. The most effective treatment for obstructive sleep apnea is continuous positive airway pressure, also known as CPAP. What we find is that patients who use their CPAP every night feel much better, are much more effective at work, and are finding that they're not falling asleep and enjoying a better quality of life.